Again, I'm Teresa Famolero, and I'm going to talk to you today about SOPS resources. So, to support the SOPS survey, ARC provides a variety of toolkit materials and resources for each survey setting mentioned earlier. You can download these materials on the SOPS website mentioned here at the top of this slide. The toolkit materials include guides on how to administer the surveys and report your results, an Excel tool that allows you to enter your data and view your results, resource lists that contain patient safety improvement initiatives organized by survey composites, a research reference list that contains published articles for all of the SOPS surveys, an action planning tool to help you improve patient safety culture, webcast and podcast replays, database reports, and materials. So the survey users guides discuss issues and major decisions involved in conducting a survey and reporting the results. There is a guide for each survey. The guides include information on getting started, selecting a sample or conducting a census, data collection methods, establishing data collection procedures, conducting web and paper-based surveys, how to optimize your response rates, preparing and analyzing data, and producing reports. For each survey setting and supplemental item set, there are data entry and analysis tools that use Microsoft Excel to assist you with entering your survey data to create tables and graphs of your survey results. Users can hand enter their data or copy and paste values from their web survey output into the data entry sheet and then see their results. To use the tool, users must have Excel macros enabled on their computer. These tools are the only resources that are not available directly on the ARC website. However, you can request these tools by contacting our help desk, which I will provide towards the end of this presentation. Here is an example of the types of results you will see in the hospital data entry and analysis tool. In this example, sample hospital A is viewing some of their composite level results against the 2018 hospital results. The database minimum and maximum scores are also shown. For each survey setting and supplemental item set, there is a resource list for users of the SOPS surveys. These documents contain links to practical resources that are free and publicly available to improve patient safety culture and patient safety. Here is a page from the hospital resource list for the organizational learning composite. We also have a research reference list that provides citations for published articles using the ARC surveys on patient safety culture and is organized by survey setting. It includes references on the use of the surveys, references about patient safety culture improvement, psychometric analysis of the surveys, which describe the reliability and validity of SOPS surveys, analysis linking the SOPS surveys to outcome data, systematic review of patient safety culture instruments, and international studies about the SOPS surveys. The Action Planning tool, also available on the ARC website, assists users of the SOPS surveys to develop an action plan to improve patient safety culture in their organization. The Action Planning tool is designed for all survey settings and is intended to use after your organization administers the survey and analyzes the results. It provides step-by-step guidance to help users develop their action plan. The tool includes an action plan template that your organization can use to document goals, initiatives, needed resources, process, and outcome measures, and timeline. It's important to remember that the first step in action planning is to share your survey results broadly within your organization. It is also really important to share unit-level results along with hospital-level and SOPS database results so that your units and departments can also develop their own action plans. One way in which we promote the work we do on SOPS is through our webcast. Webcast recordings, transcriptions, and the PowerPoint slides are available on the ARC SOPS website. Our most recent webcast on the Health IT Patient Safety Supplemental Item Set for hospitals also contains an infographic of 3 key takeaways for easy reference. ARC also supports the SOPS databases that intake data from facilities that voluntarily submit their SOPS survey data for patient safety culture improvement purposes. The number of sites and provider and staff respondents included in the latest databases are shown here on this slide. The hospital database is our largest database with over 300,000 respondents in 2018. New in 2019 is the SOPS Ambulatory Surgery Center database. Here is the SOPS database submission schedule through 2020. In gray are the current and past data submissions. We conducted data submission on the hospital and medical office surveys in 2017 and the nursing home and community pharmacy databases this year in 2018. In fact, the community pharmacy database is closing very soon. Because we can only conduct data submission on 2 databases per year, we have typically done data submission every other year. We also know that most hospitals do not administer the surveys annually, but every 18 to 24 months, because it takes time to administer the survey, distribute the results, and develop and implement action plans for improvement. In June of 2019, we will be conducting a new data submission on the Ambulatory Surgery Center database. We will also accept data on the medical office survey, including the value and efficiency supplemental items for the first time in September of 2019. Another important change to point out about the SOPS database submission schedule is that instead of accepting data in June 2019 on the hospital survey, as we would typically do, we are delaying data submission until 2020. The reason for the delay is that we will be releasing version 2.0 of the hospital survey in the summer of 2019 and want to give hospitals time to adopt and administer the new 2.0 survey. So in June 2020, we will resume data submission of the hospital survey, accepting data from versions 1.0 and versions 2.0. In addition, I just wanted to mention one other thing, is that hospital users can submit data from both the Health Information Technology Supplemental Item Set and the Hospital Value and Efficiency Supplemental Item Set for the first time in 2020. So there are benefits for participating in the SOPS databases. First, facilities that submit to the database are part of the results in our database report with all de-identified facility-level statistics. Second, participating organizations also receive a feedback report for each site submitted, comparing their results to the database. Here's a sample of a feedback report graph. These feedback reports can easily be shared with your organization or used in a PowerPoint presentation. We recommend that you share the results so that your leadership, department managers, and frontline staff understand their areas of strength and opportunities for improvement. They can also see how their facility compares to other participating organizations. So here are the requirements for participation in the SOPS databases. First of all, your organization must have administered the SOPS survey in its entirety without modifications or deletions. This ensures comparability across healthcare facilities when submitting to the SOPS databases. Your facility must be in the U.S. or U.S. territories, and you need to sign a data use agreement that indicates how the data will be used, and it also protects the confidentiality of your organization. You need to complete data collection before the end of the data submission period, and then you need to submit data files per specification. If you're in a health system, each facility must be identified in your data file as we conduct analysis at the facility level and then average results across participating facilities. Last, you need to upload your survey data through a secure online data submission system. We have extensive support for SOPS database submission, and we will share the database help desk information towards the end of this presentation. So here's the executive summary to the 2018 Hospital Database Report. For each database, we create a free database report.